The French playwright Eugène Ionesco once asked, "Why was I born if it wasn't forever?" But life, if anything, is impermanent. Flowers die, stars die, and you will die. So if you can't defeat death, what if you could postpone it, or at least postpone the diseases commonly associated with getting old? Many people, especially the ultra-wealthy in Silicon Valley, are investing money into companies trying to answer exactly those questions. Richest man in the world Jeff Bezos and billionaire PayPal co-founder Peter Thiel have both invested in the space. In 2013, Google formed aging research company Calico. There's also BioAge, BioViva, the Longevity Fund, AgeX, the Methuselah Foundation, and many others.
Whenever you meet a fundamental human need, there's a market. And in this case, the market for age-related disease and aging is a $1 trillion market.
Billionaire Oracle co-founder Larry Ellison has donated hundreds of millions of dollars to aging research. Bulletproof founder Dave Asprey has spent more than $1 million hacking his own biology.
I, right now, am expecting to live to about 180. I think that's very achievable, assuming a truck doesn't hit me.
People claiming to know what you ought to do to live longer is not anything new. Historically, as is still the case today, a lot of it just doesn't work.
This medicine is a fake. Here's how I'm a fake. Yakov's a fake. This is no good. I tell you, Mother, we're cheating all the people, don't you see?
From selling dietary supplements to stem cell injections, there is already a huge amount of money being made. Right now in San Francisco, for $8,000, you can get a liter of blood from 16 to 25-year-olds injected into your body. By one estimate, the global anti-aging market could surpass $271 billion by 2024. Goals vary too, from trying to add decades to your life to simply trying to extend the years your body remains healthy. So what's real? Because there really is new science worth being excited about, and what's just wishful thinking or straight up snake oil?
Surpassing all the medical specialists in all the hospitals of the globe. Who's going to be the first to buy a wonderful bottle of Vitazone?
If you look around for ways to live longer or look younger, you will be offered tons of solutions.
Activated charcoal is the general longevity leader in research in extending lives in animals.
I take about 150 supplements a day.
This could eliminate all disease. This perhaps is immortality.
You're bordering on sounding like snake oil.
No.
But some of the stuff's crazy. You swear that.
And some people, especially in places like Silicon Valley, are already taking sometimes elaborate steps to fight their own aging bodies.
It's our job to disrupt things. We literally go out and say, isn't there a better way to do this? So why wouldn't we disrupt medicine? Because frankly, medicine has failed us.
Part of it comes from the technology and the engineering sort of mindset that many of the people who have become wealthy in Silicon Valley have. They view human biology as something that can be engineered. And so I think that many of us who are biologists by training can look at some of the strategies that money's being thrown at and just say, that's not going to work.
The science of aging, gerontology, is not new. But fairly recent advances have changed what scientists suspect might eventually be possible. Today, if the question you're asking is, what has science proven without a doubt will help you live longer? The answer will not surprise you.
If you wanted to ask me with certainty, what could I tell you can we do to help you live longer? It's the things that we more or less already know about. Don't eat too much, exercise regularly, don't smoke.
But scientists are working on much more radical but promising approaches to attack aging.
There's been a real breakthrough in longevity research in the past couple decades. Starting in the 1990s, scientists at, for example, UCSF, discovered that you could change single genes in a tiny worm and get increases in lifespan. This opened up the possibility that evolution actually controls, in a sense, aging.
We're starting to learn a lot about the biological mechanisms of aging and the possibility of going beyond what we already know works to slow the aging process, or in some cases even functionally rejuvenate aged animals and hopefully aged people. We've got hypotheses now that have been tested in animal models but have not yet been demonstrated to have those effects in people.
For the most part, researchers are focused on increasing your health span. The length of time you're not just alive, but alive and healthy. Living longer might be a consequence, but they say it's not the primary goal.
Well, a lot of people think that scientists working on aging have as a goal to extend human lifespan or to make people immortal, to stop aging itself. I wouldn't say that that's not our goal, but our primary focus is improving the quality of life in our later years, so we're free of debilitating chronic diseases late in life.
If people live up to 110 plus years, if they had the functionality of a 20-year-old, that would be better for them, probably better for everyone around them.
So how do you do it? While their goals might be similar, scientists are approaching this in different ways.
Well, there's two schools of thought. Either it's repair or it's regulation. So if you take a young cell and an old cell that have the same DNA, then the only difference is they're regulated differently. And you can reprogram an old cell to be a young cell, and it's becoming more and more routine. That's one category of aging reversal. But other ones they're just things that flow around in your blood. Many of the essential components of your body drop with age. And if you just bump those up, then your body says, oh yeah, I'm young again. And we're not literally engineered, this is evolution, but mice die at 2 years and bowhead whales die at 200 years. And so clearly it's negotiable.
One prominent company working in the space is Unity Biotechnology. It's raised more than $300 million from investors like Jeff Bezos and Peter Thiel. Unity focuses its research on specific types of cells called senescent cells.
Cellular senescence is the accumulation of cells in our bodies as we age that no longer divide. And when cells do this, we call them senescent cells. Now, stopping dividing is not bad for you. The bad part is that when cells do this and pull this emergency brake, they begin spewing out all of these factors, these inflammatory factors and factors that destroy your tissue. And it's these factors that wind up driving a bunch of aging features and particular diseases. And if you could understand what those mechanisms were, if you could intervene in those mechanisms, you might be able to make it so we all got to live vibrant, more healthy lives.
In 2019, Unity published first-of-its-kind data from a randomized, double-blind, placebo-controlled trial on humans, specifically using anti-aging mechanisms. The study was about osteoarthritis of the knee. Patients got a shot of Unity's drug in their knee, which was meant to destroy senescent cells.
Our data in humans was the first. Then it was a small 48-patient study. This year, in 2020, we'll have 180 patients. It will be the first of its kind. My belief is that if those data are positive, that we took a feature of aging and sent it backwards in almost 200 patients, that is when things would begin to change.
Unity is developing its treatment the traditional way, by going through the rigorous steps to get FDA approval.
I believe that what all of us in this field ought to be trying to do is to make medicines to benefit as many people as possible. The best way to do that is to use the classical development path.
The disadvantage to that is it takes a long time and it's expensive. The advantage is if you get FDA approval, you can be confident that there's probably a real benefit there, and we know what the risks are.
Venture capital firm The Longevity Fund, which invests specifically in aging-related companies, also invested in Unity.
People often ask us how big the longevity market is. We don't have any earthly clue. I mean, a couple $100 billion is a number for a single age-related indication. Imagine drugs that combated all of those.
Another company working on aging is AgeX in Alameda, California. It's in a much earlier stage than Unity, and its main focus is what it calls induced tissue regeneration. In the short term, it's working on a topical hydrogel that would facilitate healing and minimize scarring. In the long term, it hopes to apply the same basic ideas to age-related disease.
Early in life, in the very earliest stages of life, if you have a heart attack, your body just grows the heart back. And so we believe if we turn the clock of cells back far enough in time, we can unlock this regenerative potential and allow the aged human body to repair itself. The basic science is already on the lab bench here. And we plan to do this with FDA, hand in hand. We want to work out delivery technologies to get these therapeutics into the body. We need to test them in animals, and we hope in a few years we'll be able to begin human clinical trials.
But even if a company operates with scientific rigor, there are important ethical and societal questions that need to be considered. Even if we can one day make people live longer, should we?
If you're living more years, but not necessarily more healthier years, what does that mean for the cost of healthcare? What does that mean for quality of life? How do we ensure that those years gained are years that people actually would like to be alive and are enjoying being alive and fully engaging in their existence?
When I was in the prime of my working days, there were 5 workers to every retired person. When the baby boomers retire, there will be 3 workers to every retired person. If we live to 150, we will go down to almost parity, where there will be 1 worker for each retired person. Over 85 is the single largest growing group of Americans. And that is going to put a burden on our health system. It's going to put a burden on our social security system. Older people are wealthier than younger people, and so they have disproportionate power in the marketplace. And all of that skews everything towards the elderly.
The biggest concern for many is that anti-aging interventions are being developed as a tool for the wealthy. Investment in such research by the ultra-rich can be seen as trying to buy the one thing money hasn't yet been able to buy them: immortality.
This utopian dream of living forever. And I do believe that the anti-aging proponents are not just interested in adding another 10 or 20 years to their lifespan. They're really looking for immortality. Immortality has been the dream of human beings, and it's been a storied part of our mythology since the earliest times. But it is a narcissistic dream, because I have yet to hear a single social good that will bring.
But again, most companies in this space say they're not actually trying to increase lifespans. They say they're trying to increase the number of years people remain healthy.
Is Unity trying to help people live forever? First, we don't know how. And even if there were a way, that's not the business we're in. Do I think that the reason that we live and operate near Silicon Valley has something to do with this idea that the Silicon Valley powerful want to live a long time? That is an easy and sort of entertaining idea. I've never gotten an email from one of those people asking, actually that's not true. I did get one, but he's not an investor. Okay.
Increasing a person's health span is perhaps less ethically consequential than significantly increasing their lifespan, but there are still important questions to be asked.
You can tell based on what socioeconomic resources a person has, what education level they have, how much money they make in their job, whether they have health insurance or not, whether that's state-funded health insurance versus private health insurance. All of those things are things that also currently affect both our health span and our lifespan. So there are many modifiable factors of human existence right now that are nowhere near as sexy as, life-extending biomechanics or medical treatments. But those should all be on the table if we're truly talking about improving the health span of humanity.
These ethical concerns aren't necessarily reasons to not pursue anti-aging therapies, but they do highlight how important it is to have conversations about ethics while you do so. The United States is a country whose poorest men die 15 years before its richest. It's 10 years for women. The richest Americans lived on average 3 years longer in 2014 than they did in 2001, and the poorest Americans didn't gain any years. Lifespan is about much more than what science knows is possible. It doesn't mean these companies shouldn't exist, but it does mean inequality around when you die can't be solved with pharmaceuticals alone. There are scientists at universities who are every day understanding more and more about how aging works. There are companies developing real, science-based drugs and techniques that may one day prove to successfully help humans combat aging. These companies are confident, perhaps, but also careful, and they're not yet selling anything.
There's a highly regulated pathway one has to go through to make it to market as a drug, and longevity companies are not exempt from that.
But there are loopholes for things like supplements that are considered natural, or procedures that involve taking stem cells from your own body and injecting them back into you that allow companies to sell products without FDA approval. Products exploiting these loopholes far outnumber companies carefully developing aging-related drugs.
The basic science is so exciting It's inevitable the public will hear about it, and it's inevitable that the charlatan will try to offer up, fake versions of real science to the public.
A little anecdote, which is, oh, my friend took the stem cell therapy and he feels great. You could probably find 100 examples where the opposite happened. So you can't use anecdotes, you have to use clinical trials.
There's nothing illegal about what people are doing, so I think it becomes more of a personal question of is it ethical or not as a scientist to start recommending to people that they take something for which there is little to no data that it will actually benefit them. There is definitely a large number of people out there who are rushing to apply what they think they know about the mouse studies in themselves. They read the literature to the extent that they're able to understand it, and they immediately try to apply whatever the newest discovery is from the basic science.
Science is very hard, and it takes years to make the insights and the progress to build a medicine to take to people. Biohacking, on the other hand, if you think about the ideas that animate it, it's that this stuff isn't complicated, that it's not hard, and what could go wrong. What you'd find is if you examined each of the underlying beliefs is that they don't hold up as correct.
So will there be incredible science fiction-esque longevity advancements in your lifetime? There might be, but you'll hear about them. They'll be clinically validated and FDA approved, and you won't have to track them down on websites trying to sell you stuff.
We're not going to add decades to human life from those drugs. It's more likely years, if anything. But we're going to see just marginal impacts on lifespan starting now, and the presumption would be that those will increase over time. So you won't see a great leap to a brighter future. You'll see year over year small changes that add up.
My expectation is that there might be a half dozen medicines, I'm talking 3 decades from now, widely used that target different mechanisms that target aging, and a series of diseases that are now inescapable. These will be features of aging that you'll read about in books. Kind of the way a public pay telephone is now. It's like, oh my goodness, look, it's a phone booth, right? It's this vestige of the old. I believe these insights and these future medicines will drive that sort of future.